but not least, Bruno Trigo, in representation of Luís Góes Pinheiro, President of SPMS. SPMS is the digital arm of the Ministry of Healthcare in Portugal. Renowned by their advances in terms of digital health, Portugal has been pioneer country in many fields, electronic prescriptions and others. And I'm sure that Bruno Trigo is going to give us here a good summary of the position and outlook for 2021. Bruno, the floor is yours.
Thank you, Paul. I don't know if you are seeing my presentation. Yes?
We are, yes, we are.
Okay. I will try to put it in a small, in big picture. That's fine.
It's fine now, yeah.
Okay, thank you for the introduction, Paul, and thank you for the two previous presentations. Very interesting, and it's always very interesting to see that the challenges in at so many levels are quite similar. I will try to be quick to gain some time, but as Paulo said, SPMS is the technical arm for the Ministry of Health. We are not only the technical, but also the procurement arm for the Ministry of Health. So SPMS does and implements and develops, maintains the systems, but also is an important arm of the Ministry of Health in terms of purchasing some items. For example, in terms of COVID, the vaccines or the individual protection equipment, all they were bought by SPMS. There are two main other arms of the Ministry of Health: ACSS, who is the financial and ruler, and DGS, who gives the clinical guidance in the Ministry of Health. These are the three main arms of the ministry. A bit of context. So, as I said, shared services are the purchasing and logistics arm for the ministry. We have some financial services as well, and human resources, shared services of human resources, but mainly we are the information and communication systems and technologies entity of the ministry. So we give all the support the Ministry of Health needs in terms of technology and in terms of implementation, the change. And as I think the first presentation from Sergio said, I think I don't need to give detail about the costs and the pain it is to implement and to change and to do the change management of all the systems and all of the process in healthcare. In terms of installations, we are present in five different locations, but mainly in Porto and Lisbon, with our headquarters and our purchasing, logistics and public procurement. But we have also in Porto and in Maia our data center and our monitoring control center of the Portuguese NHS. Also give this note about the contact center of the Portuguese NHS, the SNS 24, that is fundamental in terms of helping citizens and contacting citizens and enlightening them and with some information. And it was a big and fundamental part in managing the pandemic, the COVID pandemic, and the last few months. Our vision is to provide a good health information ecosystem to implement, but also to regulate for a more digital, integrated, and sustainable health system. As someone said before, and it's like a common phrase, we are trying to move the systems to a more the systems and the process, into a more citizen-centered way of thinking. That is not an easy process, because we have a lot of systems that are based in illness and not about the patient, or based on accounting level, on the contractualization between the hospitals and the Ministry of Health, and not about essentially the patient. To give some context or reality, we have about 54 hospitals that run our systems, 359 primary care units. These units, about 85–90% of them use our core systems. So we have two main systems in hospitals and primary care. It's the administrative system and the clinical system. I'm showing here a slide about our two main clinical systems, the S-Clinical, that is present in primary care, primary health care, but also in hospital health care. And the professionals, they spend, we did an estimate, they spend around 30 million hours a year using the clinical software in the hospital. So it's a very important platform, and we are trying to move it, or try to do the change to a more centered system, a centered citizen system, but also a centered system in a way that all the records should be seen by all the hospitals. Today, S-Clinical is a local installation. So when we try to implement centered policies, or policies that are suggested or are mandatory about the Ministry of Health, we have to implement it in all those places. Sometimes we last like 2–3 weeks to implement those changes in the system. We are trying to move it to a more centered system. Obviously, it's a big way, a big and long way, because we have to develop and to implement infrastructures that could manage all these records. As I said, we don't have only those two systems. We have like roughly 85 90 systems implemented in an NHS. We try to maintain them all and to develop all the functionalities needed to the professionals and to the system and to the citizen. Our goals are to support the healthcare system and care improving the population's health. In the previous presentation, we talked about the aging population and the multi-morbidity. So we have to change that, and have to change it in the technology and in the system, and how we try to change the process in the healthcare entities. We will try, and this is the main focus, to involve and improve the citizen experience. We have a big project in next year in telehealth and in telemonitoring. So we will have news in the next year about this, and try to involve the patient in his own health, and those records to be integrated in our EHR systems. We are trying, and we help to increase the efficiency of healthcare organizations, of course, and to improve quality, and to augment quality in the healthcare services and resource management. We also have our human resources system, and payroll is managed by SPMS. All the professionals are paid by our systems, and of course maximizing the working conditions of healthcare professionals, to try to help them and to give them time to look to the patient and to take care of the patient, and not to take care of the system. I will give you just two examples about what we did in the last month. We implemented our tele consultation platform, the RSA Live, for teleconsultations between user and doctor, but also between professionals. And as I said, we implemented it technology but we are trying to change the process still. So it's a continuous implementation process. Another project I will like to talk to you. It's our tracing tracing application, not a mobile app. It's a tracing application for the professionals, public health professionals, to contact and to trace all the contacts of infected patients with COVID. And just as I said before, we also involve the patient in his own health, trying to help the patient to auto-report his symptoms. We have nowadays like 115,000 auto-reports from patients. They report those symptoms in a platform. And also we follow up the patients, and of course not obliging them to go to the primary care center, but by contacting them by phone and trying to assist them. It was a system developed in 15 days, so it was a new record. The system lasted from functional analysis, and those that drawing from it was my drawing in 12th of March, and in 26th of March we did the implementation. I would just like to say that the success of software does not depend exclusively on the software. Software is an intervention to improve processes, and we don't want to lose our primary objective. So when we develop some software, we don't want to lose the intention of being digitally transformed, and it's something that it's intended and planned. It has an objective and not just implement technology by any chance. I would like to say very quickly, we will have our EL Summit in 2021. I would like to invite you all. It will be, we look forward for these events. I think I have a video, but I don't know if we have time, Paul, so I will try to fast forward.
Thank you.
So it's a technological and health summit held in Lisbon, which addresses important and everyday subjects like telehealth, digital health, artificial intelligence, robotics, e-procurement as well, public health. We did in 2017, 2018 and 19, but it's always a very important event in gathering people and visions, and to share and to present some of the projects, not by SPMS, but from other stakeholders from other countries, to present and to share their experiences. And of course, we would like to invite you all. We don't have a specific date still. Some big numbers from last year, 380 speakers, 90 exhibitors, more than 50 startups, and several keynotes. So I will leave here the invitation, and would like to always be available for future clarifications. And thank you for your time, of course.
Thank you so much. Same thing, I would kindly ask for a round of applause for Bruno, so that we can have a show of a presence of everybody that was attending this presentation, Bruno. So now if you watch for gallery view, you can see the thankful welcome of everybody. And definitely Bruno has to leave. He has to go for another urgent meeting. But Bruno, if you share with me the video, I promise in the end, I show the video of eHealth Summit, because the plan we have been working to is that part of the Health Summit will be the EU-India Digital Summit. So we have a special day or 2 days for the EU-India gathering in Portugal, hopefully next year, and hopefully COVID-free and with lots of testing in the opening by the sensors from INL, that will be a good miracle.